He was a man from Uzbekistan, Mr. Khusan, and he was actually film actor in Uzbekistan, famous film actor in Uzbekistan. And basically, he had got into some heart problems, like severe chest pain, angina pain, and all this. And for that, we got an angiography done. So when I went to Taskent with Max Healthcare, and I examined him and advised him for bypass surgery.
Kasalxonaning boshlanishi 2010-yilda infarkt kasalligiga duchor bo'ldim. Yurak ishemik kasalligi derkan buni. Shunda meni qon bosimim ko'tarilib ketdi. Qon bosimim 170-180 ga 220-230 bo'lib ketdi. Shundan keyin men больницаga yotdim. Больницаga yotgandan keyin 3 oy davoladim. Bizda shahar klinik 17-kasalxonasi bor. Shu yerda Taskent kandidat Xolida Mahmudovna degan ajoyib ayol, bag'ri keng, mutaxassis, yaxshi mutaxassis ayol meni mana shu 5 yil davomida o'zlari davoladilar. Undan keyin men 2012-yilda infarkt kasaliga duchor bo'ldim. 5-stomatologiya poliklinikasida tish doktori bo'lib ishlaydi. Mr.Khusan Musabaev degan odam. Shu odam aytib qoldi. Hindistondan doktor kelibdi. Yaxshi bir ajoyib doktor kelibdi. Max firmasi hozir Toshkentda 2 kun, 3 kun bo'lishar ekanda, bepul anaqa o'tkazishayotgan ekan.
He was not being able to do his regular activities. Like regular activities like walking, taking bath, having food, changing dress. All these things are getting difficult day by day. Sometimes he cannot even change his dress because of pain, chest pain. That was a very difficult case because his arteries are very badly blocked at multiple points, and that is a very complex kind of a case for bypass. So the local doctors were not very easy for doing that case, kind of reluctant, and then we decided to bring him here, and he was very happy to come to our place to get it operated.
Bu yerga kelganimdan keyin o'sha umuman meditsina personalining qilgan xizmatlari meni hayratda qoldirdi. Yoqamni tishlab qoldim. Bu yerda har bir mutaxassis o'z ilmiga, bilimiga ega. Ya'ni har bir inson o'zini ishini qiladi.
He got a immediate change in the day one after his surgery, and he immediately started feeling that there is no more chest pain, then there is no more breathlessness, there is no more palpitations. So there are major 3 changes that has happened to his bodily symptoms. So he was totally satisfied immediately on the day one.
Hamma xuddi o'z-o'zini yurt-o'zida yurgandek, o'z-o'zini shifoxonada yurgandek, hamma ochiq ko'ngil bilan, mehribonchilik bilan kutib olishdi. Operatsiyalardan juda ham yaxshi chiqdik. Mana reanimatsiya bo'limida ham juda ham yaxshi qarashdi. Bemalol kirib, ko'rib, xabar olib, turib, hamma til bilmasak ham til o'rgat nima qilib berib, yordam berib.
Language is not a barrier in our center because we have got 2 broad group of people here, or experts here. Number one, we have got 2 doctors in my team who speaks very fluent Russian. So they are present with the patient 24/7 during the operation, after the operation, or before the operation, during OPD clinics, during their follow-ups. And then, apart from these doctors, we also have a team of expert and trained interpreters who knows very fluent Russian. So language is never a barrier in my hospital performance.
O'sha doktor Ritwickga har bir bemorga o'zgacha qarashi, o'zgacha yondashisi menga katta ta'sir qoldirdi.
And in our hospital, as a whole in Max Healthcare, the quality is number 1 priority, and that's why we would like to say that we try to avoid doing unnecessary procedures in any patient. Need of the hour in this healthcare industry, or as a whole in the society, is time. We need healthy time, and we need the patient, or not only my patient, for any specialty, is that he should go back home as soon as possible from the hospital. So that is a very important aspect for a very busy executive, or a very businessman, or a very very, very busy family man also, you need to go back to your normal life very early. So in that way, I think the minimally access surgery or the keyhole surgery is a very good milestone in my center in Paparganj. We are also starting some of the very high-end equipment line like ECMOs. ECMOs are those, it's called extracorporeal membrane oxygenation. It actually helps those patients who are dying on the ventilator machine for a long time, on artificial respiratory machine. So these are the machines which help a lot of people who are need or in the ventilator for a long time. Then we have also starting the program for left ventricular assist device. It's called artificial heart, total artificial heart. It is definitely coming up in a big way, and we have already started putting in some of the centers in Max Healthcare. And I'm pretty sure that this technology is going to help a lot of millions of Indians in the coming future. My advice to everybody to follow a healthy lifestyle. Eat healthy, exercise, avoid tobacco and alcohol, and most importantly, stay stress-free.